One of the great things about personalisation is that if people are doing it right, one of the things that they do is link members of staff with people who are using the service where they've got common interests. And that of course means that you're actually going to share those same interests, have something to talk about, be able to do things positively together. So we've seen lots of examples where people have been supported to go to the cinema, to go to their local church, sometimes to go down to the local pub and enjoy a quiz, but doing that with somebody who is supporting them, which makes their jobs that much more rewarding and fulfilling than just focusing on individual tasks.
Within sort of assessment processes, where I've found that personalisation works is if you manage to work together to develop the right sort of tools for sort of care planning and support planning. And I've seen examples of where this has happened in co-production with people who use services and experts within those service areas, and working across health and social care. So one of the examples that I can talk about is where it's worked where people have been maybe in rehabilitation services, have been within a hospital setting, and those care planning approaches have then been combined with the clinical approaches to assessment and treatment of mental health, and actually step-down services have been developed that are very bespoke for individuals.
Personalised care can be really simple. For example, a gentleman has a diagnosis of dementia but wanted to continue cooking and making drinks. And at the beginning, the people who supported him thought that he wouldn't be able to do that. They thought because of his diagnosis and the impact it was having on the way he lived, it wouldn't be safe, it would be too complicated. However, with a little bit of time and with talking to his family and with thinking about the kitchen that he used, with some very small adaptations, we were able to make it so that he could continue to cook, make some meals and make some drinks. And all it took were a few bits and pieces that cost a little bit of money, but sort of like £20. And therefore we were able to make it so that he could continue doing something that was really important to him. And that's what personalisation is all about.
We have a great deal of activities that come into this home. We have nearly 100 hours of activities per week. So there's all sorts of things that the residents can get involved in that they may necessarily not have had in the past. So for example, we'll have singers coming in, we'll have pat dogs coming in, we'll have the children coming in. The children and the residents making mince pies together. And some of the men sitting down and rolling the pastry. It's just a priceless moment. You look at that and you think, yeah, this is what it's all about.